Assalamu alaikum. I'm here to provide the information regarding end feel. So basically, end feel is a type of feeling or a sensation which the examiner experiences when the joint is at the end of its available passive range of motion during assessment.
So, this characteristic feel, which is experienced by the therapist as a resistance to further motion, is called as the end feel. By determining if the pain or restriction is the main problem, the examiner can determine if a more gentle treatment should be given or a more vigorous one. When we talk about its importance, there are some major points that highlight the significance of end feel, such as to assess the type of pathology present, to identify the limiting structures and choose an effective and focused treatment, to determine a prognosis for condition, and to learn the severity of the problem.
There are different types of end feel based on the sensation and resistance felt by the therapist. Mainly, end feel is classified in two main categories: normal end feel and abnormal end feel. In normal end feel, we have three subtypes: firm end feel, soft end feel, and hard end feel. I will be discussing firm and feel in detail. By definition, firm and feel is a sensation of firm resistance or a slight give when joint is moved to its end range of motion. This type of end feel occurs when joint is limited by tension in joint capsule or other ligaments. Therefore, firm end feel in joints of human body may occur due to capsular stretch, muscular stretch, or ligamentous stretch. A number of joints of human body have firm end feel including spine. These are some examples.
I'm Tanzeel Gani and I'll be explaining normal soft and field and hardened field. Soft and field occurs when two soft tissue masses meet one another. It is painless and it is basically a yielding compression that restricts further range of motion by normal muscular bulk. Its examples include knee flexion and elbow flexion by biceps, and knee flexion when hamstrings and calf muscles meet during knee flexion. It feels soft and cushioned. Hardened field occurs when bone or cartilage meet. It is a connection between bone to bone. This is hard, unyielding, abrupt sensations, which is painless. Its examples include elbow extension, in which there is contact between olecranon process of ulna and olecranon fossa of humerus.
Assalamu alaikum, my name is Munaza. In this video, I'm going to talk about the abnormal end feel. It is that when the range of joint is less or greater than the normal one, it is painful, and it occurs when the structures other than the normal anatomy of the joint stops the motion. It mainly has five types, which are hard end feel, soft end feel, firm end feel, springy block end feel, and empty end feel. The first one is hard end feel. It is also known as bone to bone end feel. It occurs when therapist will not expect the hard. It occurs when the therapist was not expecting to find a bone to bone or hard end feel. It mostly occurs in the conditions like degenerative changes, osteoarthritis, and osteomalacia, and and it also occurs in conditions like fractures. The second one is bogey or soft end feel. It occurs if a joint has edema or effusion conditions. It may indicate acute inflammation, like for example, acute moderate to severe sprain or ligamentous injury. The example of the pathologies are soft tissue edema conditions and synovitis.
My name is Iman Heather and I will be discussing the remaining three types of the abnormal end feel. So the third one is firm end feel. In firm end feel, the range of motion is limited by a stretch. The stretch might be because of any muscular, ligamentous or capsular shortening and a muscle hypertonicity as well. The fourth one we have a spring block and feel. In spring block and feel, there is an elastic sensation, there is a rebound sensation in the end of the ROM, and patient complains pain as well. Might be because of an internal derangement. The internal derangement is because of any torn menisci or any loose cartilage as well. For example, patient is not able to extend the knee fully because of the torn menisci here. The last one we have is empty end feel. In empty end feel, there, as the name indicates, there is no sensation in the end of the ROM. And this is because of that patient doesn't let us complete the range of motion because of the pain. And the examples are abscess, any acute bursitis, or fracture, neoplasm, any inflammation, etc.